Hello and welcome to today's briefing. It's great to see everyone here today. I'm Amy Adams. I'm a senior program officer with the California Healthcare Foundation. For those of you unfamiliar with the foundation and our work, we're an independent philanthropy supporting ideas and innovations to improve the way healthcare is delivered and paid for here in California. Today's convening is one in a regular series we sponsor for Sacramento policy staff and other interested parties, focusing on key healthcare trends and issues. Before we dive in, of course, I have the requisite housekeeping matters to attend to. First, if you have not already done so, please do silence your cell phones. I also want to let everybody know that this briefing is being videotaped, and it will be available on the web, as will the full report and the slides presented today. We also have folks viewing the briefing live via the web and listening in by phone. The phones and the webcasts are in listen-only mode. You should all have received a packet when you walked in the door. It contains copies of the slides, the full report, tells you a bit about today's speakers, and also, very importantly, this brightly colored evaluation form. We would really appreciate it if you fill out the evaluation form and drop it in the back on your way out. Personally, I'd appreciate it if you wait till the end of the briefing to fill out the evaluation form, see how it goes. So let me lay out really briefly how things will unfold. First, we'll hear the report findings from Mike Perry, who led the research, and then we'll hear from this terrific reactor panel we have assembled up here. I'll be introducing them after we hear the findings. And then finally, we'll open it up to questions from the audience. So let's turn to today's topic, which is a look at consumers' enrollment experience with Covered California. The goal of this study was really to capture consumers' perspectives and really hear from the consumers in their own voices, in their own words, what their experience was with this new system, this brand new entry point to coverage. The research was conducted a couple months ago. Things have certainly evolved and changed since then, which is a good thing. But I think nonetheless you'll find the findings here very interesting and very useful going forward. A really quick teaser. In the coming months, we'll be releasing results from 2 other studies of consumers' experiences with Covered California. One is an in-depth look at people's experience applying online through Covered California. And the second is an examination of people's experience actually getting care with their new Covered California insurance. So with that, I will introduce Mike Perry. Mike is a partner at PerryUndem Research Communication, which is a nonpartisan public policy research firm focused on healthcare issues. Health reform implementation has been a main focus of PerryUndem for the last 2 years. You can imagine they've been pretty busy. Mike has studied these issues at the national, state, and local levels. So, Mike, take it away.
Hello. Thank you, Amy. As Amy mentioned, I've been living and breathing healthcare reform implementation over the last 2 years. I'm in the field just about every week listening to real people talk about, right now I'm listening to a lot of people who've been through the enrollment experience and giving me feedback on what it's like. Today we're going to focus on California, but I will say the issues that I'm going to be going over today are not necessarily unique to California. This was a big deal, a big effort to enroll millions of people in coverage, and so the kinds of challenges and problems inherent in that, I've been hearing from consumers in other states and nationally as well. I want to thank the California Healthcare Foundation for giving me the chance to be here in February. We were in the field February 4th to February 20th, and I really enjoyed hearing the details of the enrollment experience of people who applied for coverage through Covered California, and I'm going to share with you the kinds of insights and feedback they gave me. This is very much a consumer report I'm giving you. It is their voice. The improvement ideas are their ideas. Some you may not agree with or don't make sense, but these were ideas that were important to them that I feel compelled to share with you today. Lastly, I want to say this is a really good time to be having this meeting. A lot of the foundations and state agencies and government agencies I work with are beginning to start doing a look back at what worked, what didn't work, what do we need to improve, what do we need to fix, what going into next open enrollment period, what can we do better. And so even though we did this in the 5th month of open enrollment, I think this is a really good time to have this conversation to talk about what can be improved and what can be made better. So I'm going to go through what we did, just so you know the actual study, the methodology, and then I'll get into the insights. What we did is I first want to acknowledge my colleague Sean Dryden, who was with me throughout the study and who might be piping in at times to help me answer questions. But we did 8 focus groups and 15 interviews with the very diverse consumers. 44 of these individuals were found eligible for tax credits for qualified health plans. 27 of these individuals were identified as likely eligible for Medi-Cal. We wanted both experience, the Medi-Cal experience and the experience with qualified health plans. We also conducted 4 focus groups with certified enrollment counselors, CECs. They were fascinating groups. I really appreciate their frankness and their input and feedback. We mainly wanted to hear from them about the consumer experience. What were they hearing from the people they were helping to enroll? What kind of challenges were they seeing? And then we did 2 interviews with certified insurance agents. We just wanted to make sure we heard the broker point of view. It was only 2 interviews, but they echoed a lot of what we'd heard from the CECs. So all told, we heard from 105 individuals, and again, the study was done in February. We were in Bakersfield, Irvine, Los Angeles, and Oakland. We did the research in 4 languages, English, Spanish, Mandarin, and Vietnamese. 2 quick sort of caveats about this study. This was very much a point-in-time study. Some of the systems that have been changed or evolved since that time are not going to be reflected in my comments. One of those is the interface between Covered California and Medi-Cal eligibility systems. That wasn't in place. So a lot of the feedback I'm going to be giving you about the Medi-Cal enrollment process does not reflect this. Also, we tried purposely to hear from people who enrolled different ways. So we had a number of individuals who did this online. We had people who worked with CECs. We had individuals or brokers. We had individuals who did this by paper, and we had people who enrolled by phone. What we did not include in the study is people who went directly to a health plan and enrolled that way, or went directly to a Medi-Cal eligibility office and enrolled that way, okay? So it was really about Covered California and that process. So let's get into the findings. I think the first thing to keep in mind here is that these Californians wanted health coverage. They really wanted health coverage. They spent a lot of time talking about how difficult life was, being uninsured, the anxiety, the challenges, the bills, the debts. That's where we always started these focus groups or interviews. They wanted health coverage. The intensity of those feelings varied, though. We had some individuals with chronic health conditions who had personally experienced debt. They were very motivated consumers. They tended to be the ones who applied in October or November, very early on in the process, really driven to get health coverage. But we had a number of young, healthy kinds of consumers who had enrolled later in the process in January, late January, by the time we did this study. And their motivations were slightly different. A little less urgency around this need, but I'll get into their motivations in a minute. But there were some consumers who really had been paying attention to the Affordable Care Act, the debate. They were waiting for California to come, and they really took advantage of it. An important insight is at the end of every focus group or interviewed, I asked what it felt like to have health insurance. Is there something different? Is there some new feeling? And there was. 3 themes came out. One is security, another is relief, and then the other was control. And the control was new for me. I hadn't heard that yet. This idea of being in control of their health. And this even included individuals who hadn't seen their doctor yet, hadn't made an appointment, hadn't even used their insurance yet. But they felt that they were in control. They knew they could do that. So control was a really important sort of value of this experience. And even though there were challenges along the way, I have to tell you, most of these consumers were really thankful in the end that they got insurance. They felt they were in a better place. So what were the motivations? Financial security was really the driver for many of these Californians. It was really, and this reflects national work and other work that I'm doing, this is really a financial decision for a lot of people to enroll, and that was really the driver, avoiding big medical bills, having financial security. But it was pretty prominent in this research, the idea that this was also the law. I think the mandate really played out, at least among these individuals, that it was required of them. They were supposed to have health insurance. The CECs in this research told me that a lot of Latinos who they helped enroll talked a lot about this requirement to have health insurance and that they're supposed to have health insurance. And that was the reason they often gave for why they were coming in to enroll. There was also this sense, this hope that this could be affordable. There was a lot of skepticism among these Californians that this really was going to be affordable, but there was the hope that it would be, and that drove some people to check out their options. And then lastly, it wasn't a message, it wasn't an ad, it wasn't something they heard, it was their mom who actually got them to enroll. Moms played big. Girlfriend, the sister-in-law, it was always some family member. Mom was the most dominant, but it was that person saying, you got to do this, and keeping on them. And I think we can't underestimate, in the end, what an important driver that was, that families getting family members, friends getting friends to enroll. So knowledge gaps remained after enrollment. My sense was going into this research that, and in the first part of the focus groups and the interviews, they didn't come in with a lot of knowledge of what this experience was going to be like and what the options were going to be. There were some big gaps. What was interesting is those gaps remained at the end. So these individuals, even though they'd enrolled, sounded a lot to me like the individuals I was talking to in November and December still. They still had a lot of knowledge gaps. So we can't think that just because so many people enrolled, they know a lot about this experience. They know how to use their insurance, for example. A lot of big information gaps that we still need to fix. This was a confusing time period for a lot of people. So one of the things that was striking, and I don't even know if this is a problem or maybe a good thing, is they tended to conflate Obamacare with Covered California with Medi-Cal. They just didn't know the connection between those things at all. And the CECs told us people came in asking for Obamacare. That's what they kept on coming in, asking for Obamacare. So it's interesting, does the brand matter or not, or is it okay that these things were conflated in people's minds? There's still not clarity among even the people who were enrolled, what actually they enrolled through. There wasn't that much knowledge about Medi-Cal being expanded that really a lot of people were surprised in our study who ended up likely eligible for Medi-Cal. They were surprised that that was the case. They didn't anticipate it. That word hadn't gone out there in February among these folks. They didn't know much about the tax credit at all. That was another surprise for people. They didn't know financial assistance was available. They didn't know they may have to pay it back. That was probably the biggest information gap, that if they miscalculated, if their income goes up, they may have to pay it back. That was just missing for a lot of people. Another big gap was that in-person assistance was available, was not known. So we had 44 individuals who applied online. A number of those individuals said they would have liked the option of in-person assistance. They just didn't know. Somehow it was missing in their understanding of what this process was, is that they could get in-person assistance. And then I think the challenge right now for all the newly enrolled is how insurance works. There's a lot of people out there who just don't know how it works. I mean, we had an individual who successfully enrolled who still goes to the free clinic to get her health care because she doesn't know how to use her insurance. She's worried about what cost she's going to incur and what cost sharing means and how to work it. So there's a lot of questions about insurance. So what do we do now with this population of newly insured people who don't really know how to use insurance? So there were some challenges. Some people breezed through this process just fine, didn't have problems in our study. There were some who had challenges, a number who had challenges, and I'm going to identify some of those right now. The early applicants complained a lot about the glitches, website technical problems. You guys all know about those. I don't need to go over those. But the October and November enrollers had to try numerous times to try and get in the system. The second thing that was more felt even now later in the enrollment process was how to figure out their income. So this was a problem for people who are self-employed, for people who get paid in cash, seasonal workers, people whose incomes go up and down. It was just really compelling to hear them talk about them trying to calculate. It's not just sort of doing the math. It was just trying to figure out what would be the best, what would get them the best price in their insurance. They put in different numbers and then just settled on a number. So they really needed guidance. Some were worried that they're going to get in trouble because they miscalculated their income. So figuring out income was a big deal and hard. The documentation that people had to supply in this process was surprising to a number of people. Almost everybody in our focus groups and interviews had to supply a lot of documentation. And I think there was a sense that this was going to be a more streamlined process, and that they were surprised. Most of them could get their hands on it, no problem, but it tended to cause delays. It was unexpected. We had a number of people who'd already got their plan, their card, had already started using their insurance, got a letter. They still owed further documentation. That unsettled them. Are they going to take my insurance away? So the documentation requirement was something that surprised a lot of people. The call center mixed experience among these, and I know the call center has evolved since we did these groups, but there was a lot of issues with the long waits and getting through, and that was heard in every single focus group, that was a challenge. They really appreciated that the call center was there. A lot of these individuals in our study were thankful they could talk to somebody and ask questions, but getting through was hard. Once they got through, they were happy. They were generally happy with the person was spent time with them, answered their questions, didn't rush them, very nice. So they had good things to say. Some people finished their enrollment process, by phone. They loved that. That was great, but getting through was a problem. The online chat function didn't work for anybody in our study. Not a lot of people tried it, but a number did, and it just didn't work. They just come timing out. They just couldn't get through. I know that's also been addressed since then, but that was a challenge for these individuals. So I think there was a lot of interest going into this open enrollment period. What was the plan, choosing a plan? What was that going to be like online for individuals, particularly those who hadn't purchased insurance before? So a number of the individuals who were enrolling in a qualified health plan just didn't do the preparation before they got into the system. So some did use the shop and compare tool. Some did call their provider in advance and say, okay, what plans do you take? But a lot of these individuals didn't. And so they're in the process. They're trying to choose a plan, and they were overwhelmed. Some said the physician tool, search tool, wasn't working. So that was a big factor in their plan choice. What doctor is in my plan? And they couldn't use that function. Figuring out the costs, that probably was the biggest challenge for individuals. They are not used to weighing premiums, deductibles, copays, total out-of-pocket costs. They were most familiar with premium. My take was premium was the main thing they ended up basing their decision on. It wasn't just trying to do the math here. It was also trying to understand what these costs are, and they just overwhelmed them. Those with prior health insurance experience, they did much better. And then interesting insight, a lot of people in the end didn't think it was really a big deal, that they weren't as informed in the plan choice section as they could have been, because they felt they could switch. Well, I'll get in this plan, then I'll switch out of it. And they didn't seem to understand that they really couldn't just randomly switch into another plan and that they were going to stay in that plan. So that's a challenge. That's something they didn't know going in. So the Medi-Cal eligibles reported a lot of confusion and delays. Those were their issues. Like I said, a number of people were surprised that they were eligible for Medi-Cal. They didn't know it had expanded. They didn't know that they were going to be eligible. Those online were frustrated. They couldn't continue in February when we were doing this study. They couldn't continue the process online. It just didn't make sense to them. Why can't I just finish this online? I can see this next section where I might be able to choose a plan, but I can't get there. And anyway, so they were frustrated. They couldn't finish online. At that point where they were deemed likely eligible for Medi-Cal, that's where it got confusing. Who's going to contact me? How long do I wait? Who's in control of my application now? Who should I really be calling, Covered California or Medi-Cal? Do I need to reapply if I haven't heard for a while? These were the questions that were frustrating. We had a number of people who were still in that waiting period, and they were very frustrated. There was also a letter from Covered California that added to the confusion. That letter started with indicating that they were not eligible for a qualified health plan through Covered California. Lower down in that letter, it talked about you may be eligible for Medi-Cal. I see some heads nodding. The CECs told me about this letter. They got a lot of phone calls. It added to the confusion about people's eligibility. I know that letter has probably been fixed since then, but when we were doing the group, that was adding to the confusion about people's status and who was in control. Is coverage ultimately affordable? I think that was a big question going in. I think I did a lot of research before open enrollment, and affordability was a big issue for the public. Is this really going to be affordable or not? And that was going to be the deciding factor whether they were going to choose a plan or not. So this study suggests there's mixed feelings about affordability, as you can imagine. It really depended on where people were coming from and what premiums they saw. Those with the lower premium amounts, when we did the focus groups, there were about 3 or 4 people who were really happy with their premium. It was a good deal. They were really thankful. It was lower than what they'd paid before. It was great. Then we had about 3 or 4 in every group who were not so happy. They didn't think they were going to use their insurance that much. They hadn't had insurance before. They were frustrated. So it really depended on how much they were paying and where they were coming from. So we did a lot of research with Latinos. We know they're a key population in this state. We did a lot of this research in Spanish. The issues I've already gone over were all there for the Latino population. There were 2 unique issues that came up that I want to raise with this population. One was the detailed questions about family that you have to input data on in the application. Made a number of Latinos in the study really nervous. They were just worried about immigration problems. If they were from a mixed status family, they didn't understand why a family member not applying for coverage, they had to fill out that information. A number of the CECs felt it may be keeping Latinos from applying, filling out that kind of detailed information, these kind of immigration concerns. A second thing that emerged not only from the consumers but from the CECs is the idea that Latinos could lose their home if they applied in Medi-Cal. It just came up in the Latino population for some reason, and it was, you heard it from a 25-year-old in the focus group. I mean, it's not sort of the older population who this may be a legitimate concern, but it was a widespread feeling that if I enroll in Medi-Cal, they can come back and take my home at some point. That CECs explained they had to do a lot of explanation around that misunderstanding. So that was an issue. For the Mandarin and Vietnamese-speaking consumers, language was the issue. There were language barriers there in a lot of different ways. In one way, they felt that in their communities, among their friends and peers, that awareness was lower than maybe in other populations, that the way it really spread was word of mouth, friend to friend, family to family is how it spread. There was some frustration that the online application was not in their language. For some of these individuals, that was the preferred way to enroll, and they just couldn't, and so that was frustrating. Some relied on English proficient family members to really assist them to enroll, which was great. But when they needed to get back into their account, for example, or the communications from Covered California didn't come in the right language, they couldn't really access that or control that. It was frustrating. So I have one slide here on the CECs and agents. They gave a lot of information, and in the full report, you'll see more information from them. One of the key things that came out of this study is the CECs we talked to didn't feel really prepared starting in October to enroll people. They felt the training was not sufficient, and they had a lot of gaps in their knowledge. They hadn't really used the system before, and they just felt they had to learn it through trial and error. They had to figure out things on their own. They sort of felt out there on their own. They relied on colleagues and people in their office who had more experience than them. And so there really was a steep learning curve for the CECs. There's a dedicated line. It started in February, started in the middle of our study for CECs to call to get information and to get help. If they have a consumer in front of them, they're trying to help enroll, and they have a question, they love that dedicated line. We heard a lot of good things about it. The first night of focus groups, however, was before that line was in place, and so a lot of CECs talked about having to wait in the same queue for the call center as consumers. And you're waiting, someone's waiting to have you help them, and you're waiting on the phone for 45 minutes, and that was challenging. A challenge for some CECs is that if they didn't have prior Medi-Cal experience, they were sort of lost with how to deal with their consumers who were likely eligible for Medi-Cal. They didn't know how to interact with the Medi-Cal system. They didn't know how to explain the enrollment process. They found it awkward to be the main contact for someone who was ultimately going to be enrolled in Medi-Cal. Those who had the Medi-Cal prior experience were just much more prepared to help these consumers and explain the process. The 2 agents we talked to was only 2, but they echoed all these same themes as well. I think their issue was when we talked to them in February, there still wasn't an agent-specific line. So these agents told us that they still had to go through the consumer line to try and get answers to their questions, and that was a challenge. So let me end up here. I'm going to talk about the improvement ideas. These come from the consumers. So there's a bunch of ideas that we're calling open the door wider or easing the enrollment process. One of them has to do with reducing call center wait times. That was a lightning rod kind of issue in the focus groups, very frustrating. They want more staff. They want extended hours. They don't want such long waits. They want to shorten the Medi-Cal processing time. 4 weeks was too long for a lot of the consumers in the study to wait and see. They wanted to know about in-person enrollment. Like I said, there were a number of people who applied online. They really wished they had known there was an alternative. And then they want the Covered California online application translated into other languages. They also suggested improvements in how Covered California and Medi-Cal communicate with them. One of them is they want to know about documentation. Even if it's there, they didn't notice that there was any information about what documents they were going to need, what they needed to bring with them. So for the first timers, the documentation requirements were pretty stiff. They also want to improve the letters and the communication. So I already talked about the letter that was problematic. So they want letters to really be simpler, don't have the bad news first kind of advice. Translate them into Chinese and Vietnamese. So just really review the communications. They're very confused. They're very anxious about their coverage, and they just want that known. And then they want the Medi-Cal enrollment process mapped out for them more clearly. They just didn't quite understand what to expect. They had some ideas around improving website usability, so the online chat function, I know, which has already been addressed, but it was an issue for these individuals. They want the provider search function to work better. And then they want more guidance around how to calculate income, some real-life examples of income calculation that could guide them. They want knowledge gaps filled. Like I said, they still persist. So this enrolled group doesn't really know that much more than the unenrolled group. And so they really want to learn more. Latinos, I mentioned the 2 worries they have. They want those addressed, specifically around immigration and losing their home. The Chinese and Vietnamese participants really wanted even more outreach, person-to-person, on the ground kind of outreach in their communities. They want, and I thought this was interesting, they came up with the idea of new resources to explain insurance to them. They don't know how to use insurance, so maybe there's an opportunity to create a new resource here. And then they still think messages around the tax credit and Medicaid expansion messages have to still be out there because they think a lot of people don't know. And then the last slide here, the last changes are around supporting CECs and agents. They want a refresher training. So even those who've enrolled a lot of people, and we had very savvy CECs in the study, they want a refresher training. They really want to make it real life scenarios, complicated cases, and just really on the ground kind of training. And then they want a feedback loop. They learned a lot from each other. They love the focus groups, hearing ideas, solving problems together. They want more of that kind of opportunity. So I will stop there. I'm sure you guys will have questions in a little bit, and I'll leave it to our next speaker.
Thank you, Mike. So now we'll turn to our reactor panel. And commenting first will be Sara Soto-Taylor, Deputy Director of Community Relations for Covered California.
So I wanted to start off by saying that at the center of all of our work at Covered California are the people that we serve. And so Covered California is committed to offering a consumer-friendly experience that is accessible to all of Californians. Certainly all of the information that was gathered in the report we will be taking back and looking at our strategies, particularly in the marketing side, and how it is that we're communicating with consumers about those knowledge gaps that were identified. But my comments are going to be focused in a little bit more on what we're doing with our counselor program. And I wanted to first start off by putting everything into context. So as we know, this study took place between October and January 31st. It's no secret that we had a very slow ramp-up period for counselors to be in the field working with consumers. So around January or so, we had around 3,400. Certified enrollment counselors. At the end of open enrollment, we had over 5,500. That's 5,500 certified enrollment counselors in addition to the over 12,000 certified insurance agents and over 10,000 county workers that were in the field ready to assist consumers. So we anticipate that the next open enrollment period, more folks will be able to access those resources in the community. But also the media campaign, it was in full gear. We were doing a lot of commercials, as many of you saw, the welcome to a new state of health. And it wasn't until towards the end of the open enrollment period that we really shift gears and we really started messaging to consumers, go to local help. get your local assistance through certified counselors, insurance agents, and certainly at the county level. So that shift in strategy, I think, also probably would influence a similar study that would be conducted towards the end of open enrollment. One of the things that I wanted to focus on was, what have we learned through this study? And I recognize many of you. There's many familiar faces in the audience, and these are all discussion topics that we've also talked of in our monthly board meetings. But really taking a step back and looking at what can we do differently. This open enrollment period was hectic for all of us. Everyone who worked at Covered California, everyone who's in the field, the counselors, et cetera. But if we look towards the next open enrollment period, it will be as complex, if not more. So we need to brace ourselves for that challenge and look to see what can we do better. We have over 1 million individuals who have enrolled in Covered California. That means that many of them will have to be going through renewals. And that's at the same time that we're trying to get new enrollments. And then Medi-Cal is certainly ongoing. So I say that only because, the work that has been done here is very important, and we are going to be looking at it very closely. The three areas that I wanted to touch on as it relates to the certified enrollment counselors are the training. I only have 2 minutes. I better talk quick. Okay. The training in particular. So we do know that there were certainly gaps, how to choose a plan, but in particular, we really want to look towards how can we improve some of the techniques and strategies that the counselors are using. This is, in many times, and I'm focusing here on the QHP populations, we have to sell something. It's not about signing up for free coverage, but so how do we arm the counselors with those tools to be able to, one, address the knowledge gap as it relates to insurance in the community, but then how do we encourage people to sign up for coverage and purchase coverage? Consumer education, certainly we will be looking at what other brochures, pamphlets, other takeaway materials can we provide to our service channels so that they can help educate the consumers. In the area of addressing language barriers, and in particular Latino population, I just wanted to end by saying that what we had during the first open enrollment period was a great set of people in the field. Outreach and education grantees dealing mostly with raising awareness. Then we had the counselors that were dealing mostly with enrollment. This next open enrollment period, our focus will be on merging those two activities. We're focusing more on a navigator grant type of a program in which we will be partnering with key organizations that have access to our target population that can really provide that extra level of education, as we've talked about here, as well as providing that in-person assistance so that we are really leveraging the existing resources. And once again, we welcome the partnership, particularly with the Department of Healthcare Services and all the county workers, because together it is a partnership. We are working together to see what is it that we can do to improve the consumer experience, whether that's on the service center side or on the ground with our service channels. So in closing, I just wanted to thank you again for this opportunity to comment. A lot of really good work was put into this study, and we hope to be able to take as much of this back to our programmatic areas and improve the programs. Thank you.
Thank you so much, Sara. Next will be Anastasia Dodson, Associate Director of Policy from the California Department of Health Services.
Hi, everyone. Good afternoon. Thanks so much to the Healthcare Foundation for this opportunity for dialogue. I think just to start off, to me, the theme that emerges from all this is that multiple things can be true at the same time. That we can have a year of transition, we can have a year of many people enrolling in coverage, and we can have a year of challenges in terms of automation system and just getting through the huge volume of applications. And so we're glad to have a dialogue on all of these issues. We have many venues to get this information and to have a dialogue. We have actually a consumer email box that we get emails from consumers. We have conversations all the time with our county partners, with Covered Cal, and social media, and so there's a lot of ways that we can get input, and this is, I think, one way. We have multiple lenses to look at the consumer experience. And when we look at what's happened over the last 6 months, we're, not to be too, Pollyanna on all of this, but so excited to have so many people enrolled in Medi-Cal. It's just really, really wonderful that so many more people are getting this opportunity to enroll, to get good, high-quality coverage, and to have get that coverage delivered through quality health plans. So I want to make sure that that is also part of this dialogue, that many more people are getting coverage through the last 6 months of the hard work of all our partners. The other thing that we need to sort of reckon with in all this is the branding. As you said, some people don't know, they may not be familiar with exactly what Medi-Cal is and how it fits in with Covered California and the Covered California portal. And, so in some of the work that we do, we try to really emphasize coveredca.com is the name of the portal where you can get Medi-Cal. Medi-Cal's open year-round. And I think that's one of the issues that we'll continue to work on through the next 6 months, a year, 2 years, is how to communicate with consumers in a way that maps out how they can get enrolled through this portal and as a single streamlined app, and that Medi-Cal is open year-round. And in fact, that's one of the things we're working on right now with our 1296 stakeholder group, is what to put on the homepage of coveredca.com, Covered California, how to communicate with people about enrolling for Medi-Cal throughout the year, and then several other sort of nuanced issues with enrollment questions. And so it's not something that we at the department think that we have the solution for. It's a dialogue with all of you, with stakeholders, with our partners, to work through these issues, and with consumers as well. And I'm sure in the coming months we'll continue to do that, and we'll refine the messages. The other thing certainly, we know that there are challenges, and there's functionality issues with the portal, with the rules engine, that need to continue to get refined, and that has led to people waiting for getting their Medi-Cal eligibility completed. And it's just, been a very challenging year all around, with a number of applications, a new set of rules, and trying to get those rules programmed into a new system, getting a new system launched. And we've all been working hard. Counties have been working extremely hard. Covered Cal, our CBO partners, our provider partners. And like I say, multiple things can be true at the same time. Everybody is working hard. There's just a huge volume of people coming in, and we know that in a few months that backlog's going to get worked through, and people are, it's going to get sorted out in the next couple of months. But for now, I know in some ways it's dissatisfying, but I would encourage you all to be proud of the number of people that have gotten enrolled. And I guess one more thing I just want to point out as well is that we probably need to keep looking ahead, as you say, for the open enrollment period, and for the renewals that we have coming up, as well as the renewals in 2015. So we're flying the ship and building it at the same time, but we know that all of these are opportunities for finding ways to refine the message and keep adding functionality in and making sure we're all working together. Thanks.
Thank you, Anastasia. Now we'll hear from Frank Mecca. Frank is the Executive Director of the County Welfare Directors Association of California.
Thank you, Amy. And thanks to the Foundation for the opportunity to comment. My members and the thousands of employees that work for us could not be more excited to be part of this terrific endeavor. I'm going to focus my comments, given the time constraints, on the enrollment observations in the report with respect to particularly people experiencing Medi-Cal. My overall reaction to the report is that the customer experiences that were reported through the focus groups are completely expected, not the least bit surprising. In fact, from my standpoint, they're the inevitable result of three key factors. And I bring them up not to Monday morning quarterback, but to allow us to understand the dynamics that have led to the customer experience so that we can meaningfully move forward to make sure that in the future the experience is better. So what are the three factors? The first, I think, is a national dialogue and a state marketing effort that were somewhat misleading about how simple the enrollment for this program is going to be. I think we oversold simplicity. I think it's a result of the second factor is deliberate design decisions and policy choices that prioritized upfront the APTC experience over the Medi-Cal experience. And without judgment as to whether or not that was the right way to go, I think it's a factor and a key factor in the experience in Medi-Cal, which the report points out seemed more problematic for people than the APTC experience. And then the last, as Anastasia referenced, are just significant delays and issues with the technology that are perhaps inevitable when you think about rolling out something so big so fast, but they clearly were at the heart of much of the experience, particularly during the time frame when the respondents were having their experience. So a little bit on each of these three factors. The first is the misleading dialogue and marketing. If you read the report, it's replete with comments by respondents that they didn't understand that Medi-Cal was expanded. I didn't understand Medi-Cal. I didn't understand that Medi-Cal wasn't the same as Obamacare. I didn't know I had an in-person option. I didn't realize how complicated the documentation requirements were going to be. And I think really there seemed to be such great optimism and perhaps in retrospect naive hope that by having a single modified adjusted gross income test for both the Medi-Cal expansion and for APTC, that things would really get super simple. And I think we sold that. And as it turns out, it's not as simple as we thought. It's simpler, and that's a good thing. But when a client says, gosh, I'm really surprised I had to submit all this information about my income, well, that's because if the income that you report is substantially different than the income that's in the federal hub, we have to ask you for it, and you have to send it in. And I think that doesn't comport with the dialogue nationally or in the state about how simple it was going to be to sign up for Obamacare. The second sort of sub-theme in this is the debranding of Medi-Cal. I think it was a really interesting and important dialogue about how do you take these two very different things, Medi-Cal and APTC, and market it and promote it so that people apply for both. I think what we did was make it difficult for people to understand the difference between the two, so at the moment that they needed to understand it, they did not. So when a memo comes out, a letter comes out, says, hey, you didn't qualify for Covered California, they don't know that that means they might qualify for Medi-Cal. The second issue were design decisions that prioritized the APTC experience. So the interface was 4 months late. It created a huge backlog and really contributed to the experiences that Medi-Cal recipients are experiencing right now. Medi-Cal plan selection was delayed. So that can't be done in an automated way, but if you're on APTC, you can get your plan selection in an automated way. And Medi-Cal, that functionality will be deployed in the future. How do we communicate with Medi-Cal recipients? The notice of action. We don't have notices of action even yet. Hopefully this week. But a key way to communicate with people what's happening to them has not been available to us because the technology hasn't done it yet. And then finally, the unplanned technology issues associated with the sluggishness of the interface or known defects in the CalHER system that, for example, if you're a permanent resident under color of law and you're eligible for full scope Medi-Cal, right now the system doesn't know that. Gives you the wrong answer. So we're working through with our partners workarounds so that we don't give people the wrong answer. But what we do in the meantime is we pend them. So when people pend, because there are slowness or defects, backlogs occur. And then they report in a focus group that, I don't know what's going on right now. It's taken a while, I don't know who I should call. So it's really sort of the inevitable result of where we are. The technology we're going to fix. I think the architecture of the relationship between SAWS and CalHERs, this is a moment for us to reflect upon. As I believe it's also a moment for us to reflect on in the future, the marketing of the two products that fall within what was authorized by the Affordable Care Act. And in conclusion, I would just like to say thousands of incredibly hardworking people have been dedicating everything they can to making coverage work. None of this is about blame. This is about really understanding what we've done and why, and making the appropriate mid-course corrections so that hopefully after the next open enrollment period, the customer experience is better than it was in the first one. And I'd just like to say, for any of you who don't know Anastasia Dodson, my members so appreciate her her actions and activities to try to make this system work as well as it possibly can. And I would be remiss if I didn't take this moment to say thank you to Anastasia and to everyone on the panel. But just a real plug for Anastasia, because she's really helping think through, build bridges, and get the coverage working the way it was intended.
Great. Thank you so much, Frank. So finally, we'll turn to Sonia Vasquez. She's Policy Director with Community Health Councils. Sonia.
Great, thank you. So recently someone told me that I need to look at the big picture. Health reform is a massive endeavor, and we should be recognizing the positive and not focusing on the issues and the problems. As an enrollment entity and as a convener of enrollment entities, I feel comfortable in saying that we are all so proud to be a part of this historic moment. However, that bigger picture starts to fade when you have consumers in your office crying, frustrated, not knowing what to do or how to make the right choice. Your staff are exhausted from the amount of case management and education it takes to truly help a consumer enroll in coverage. And your partners call you almost daily, frustrated because they don't know how to troubleshoot issues that should be simple. What this report reminds us is that in spite of the successes, we still have improvements to be made. Even though many improvements have been done since the report, there are still some things that continue to persist today. One, enrollment barriers. I'm not going to harp on the issues. Our partners at DHCS and Covered California, they know what they are. They're working really hard to fix them, and we commend them for that. However, as a consumer advocate, it's my job to ensure that these things get recognized. And I want to just highlight two. One that's noted in the report is around language barriers. So yes, we get that there are language barriers for people that don't speak English. I would also push that a bit further and say there are language barriers for those of us that speak English. I don't know, to be honest. I've had consumers come into my office and so confused. I've met people at events and been able to go into their application and make a change for them because they misunderstood what the income questions were or the tax questions. I had an individual that accidentally withdrew his application because when he was talking with the customer service center, he was explaining something as he saw it on the application, and the customer service center rep clearly didn't understand him, and so they suggested he withdraw the application, which was not the right thing to do. So luckily he came into our office and we were able to fix that. The other key thing, as we've already mentioned, is what happens for those people that are found Medi-Cal eligible. There's nothing on the system that really explains what the next steps are. And unless you are in this world or have been in this world of enrollment for a while, you don't have the experience or the knowledge of what to do next or who to call. I had a CEC tell me the other day that she thought once it went to Medi-Cal, it was done. She was done with the application. Lo and behold, she was really stunned when a consumer called her and said, but you're my CEC, it says so on my letter, and that I'm supposed to call you when I have issues and problems. So I know that DHS and Covered California are working on these issues, and so we just can't wait to see them corrected. The other that was really highlighted in the report is around the information gap. I recently had a panic thought. We have like 1 million people that have enrolled in coverage. What happens if 1 million people disenroll? Now, I don't expect that to happen, but I do worry that once people start paying the premiums, and let's be honest, for some people, if you're 55 or older, that's some pricey premiums that you're paying, that they're not going to be able to do that. We have people that don't know how to use their coverage, and they worry that they made the wrong decision about the plan that they chose. As noted in the report, people are confused by their health plan choices. We do our best to explain the essential benefits, the difference between the tiers, but we can't adequately explain to people, so if you have this kind of surgery or you need that kind of medication, this is exactly what's going to cost you. People want to know what 20% of what means, and we don't have the information or the knowledge to tell them that. nor can we tell them what's the best primary doctor to pick. We don't know. It's going to depend on their situation, and we're not equipped enough to tell them all of that. Consumers are not clear about Medi-Cal. They know people, or they've encountered Medi-Cal before, so they have a negative connotation of what Medi-Cal really is. And so moving forward, we would encourage the state, DHCS and Covered California, to work together to figure out how Medi-Cal can be infused in the Covered California marketing, so it's not seen as two separate programs, but a joint and comprehensive system. And third, finally, CECs need support. In order for us to do our job well and provide consumers the support they need, we need resources. The assisters page is great, the new CEC line is great, the weekly webinars are great, but we need more. For those of us, like I said, for those of us that have been doing this work for a while, we know how to get the support that our consumers need. We know where to go, we know who to talk to. But there are a number of CECs out there that are struggling, and they want to do the right thing, they just don't know where to go. We would encourage the state to really think about tying people or connecting people to local resources. There are local training organizations, there are local groups like ourselves that bring people together to share resources, and they happen in every county. Also, I would encourage the state to really think about what it takes to truly get people enrolled and the amount of case management and education that we're really spending on people to ensure that they make the right choices. Things have improved tremendously, but we still have a ways to go. Yes, we have to think about the big picture, but we can't forget all of the people struggling to get in that picture. Thank you.
Great. Thank you, Sonia. Terrific. So now's the time when we'll open it up to the audience for questions. If you have a question, please raise your hand. We'll have people circulating with mics. I'll call on you from up here. And before you ask your question, if you don't mind, please introduce yourself and identify your organization or your office. Thank you.
These presentations, at least the two I saw when I came in late, were very, very good. And then particularly, I know Frank and your role there in your association has been essential. I mean, I've talked to a number of people throughout the state, including the LA County, and they talked about the extra energy, if you will, that's been put out. And I know the community health councils had a long-term experience in dealing with our communities. But one of the dilemmas that I saw, and we saw early, in fact, we tried to make it known to Covered California, the department, is this issue of thinking about Medi-Cal on one side and Covered California on the other. In point of fact, in many of these communities, you have the same people. These are the same communities are intertwined within families. So one of the flaws, if you will, moving in to the process is that wasn't thoroughly understood by senior people, either in the department or in Covered California. And I'd have to say, virtually everything that was done in the last 45 days of the campaign, there was amazing things that were done with respect to Latinos, okay? All these things were said and articulated for a year previous. Not one of those things was actually new or a new idea. So it's an issue of, a point is that we've never done this before, never on this, in this size and this capacity in the state level. We've learned a lot, and I would have to say, and I would hope that this learning period that Peter Lee talked about over the next 90 days or so, you not only draw in the experts, if you will, but also the community-based organizations that for one reason or another were not able to participate in the process because of the arcane nature of the contracting process and a whole range of other issues I'm not going to even get into. My name is Gil Heather.
Thank you.
California Program on Access to Care, University of California, Berkeley.
Carrie Sanders with the California Pan-Ethnic Health Network, and I see, all the folks that we've been working with for the past 8 months on the rollout, and really want to appreciate the work, the amount of work and tremendous effort that all of you have put into this. It's our honor and pleasure to continue working with you to make the system stronger. I just, wanted to say I appreciate the report and some of the recommendations at the end, because I think they are important for us to think about moving forward. And so I have some questions related to that. But one in particular is sort of thinking about the next steps. I know Sara talked about, renewals are going to be really big. And you mentioned some materials that you're all developing, and I know we've had similar conversations, I think, with DHCS over how to kind of decrease the knowledge gap, particularly for folks who are new to insurance. It's one of our big concerns because we work with a lot of groups that, you know, are working in limited English proficient communities where the knowledge gaps are even greater, you could say, although you're right, Sonia's right, English, you know, we all have the same knowledge gaps that we're starting out with. And that's an area that really concerns me because I think people keep thinking that the health plans, that's their job, they're gonna follow up with consumers. I don't think that, and there isn't a health plan on this panel, but you know, I imagine that that's not happening at the levels that, you know, are gonna need to happen to keep people in the insurance coverage that they have. So that's one question, if I could just sneak in a second.
So the question is, what is Covered California
Yeah, just
and
in terms
perhaps
of,
the
next,
state
like,
department
thoughts
doing on that?
Right,
Okay.
thoughts on utilization and what types of, you know, materials, support, resources, you know, they're prepared to put
Okay.
forward to that.
Let's give folks a chance to respond to that, and then we'll take your second question.
Sure. So you're correct in that we've said publicly that we will be working with our health plan partners, and that's still the course. We have contract language that requires them to participate in educating consumers about how to access the care, PCP. You know, we talked a little bit, someone commented about, you know, well, what's 20% of my co-insurance or 20% of my copayment? You know, that's the role of our health plan partners. But that's not to say that we're not there with them as well. So we have regular meetings with our health plan partners, and the issue and the whole process of renewals going into next year, they're already talking about it. We're already talking, and the plans themselves are already thinking of how is it that we're going to be retaining these members. So they have a self-interest in retaining their members, and we're certainly going to be working with them very closely to make sure that our consumers are getting the care that they need and that they're being educated at the level that they need to be in order to gain access to care and certainly the utilization aspect of it.
Yeah, and just for DHCS and Medi-Cal, certainly it's important for us to continue the efforts that we have already been making and will continue to make on making sure that plans are working very closely with their members and working on our utilization efforts, et cetera. But also, there will be people this month, next month, almost right away, that will be transitioning back and forth between the programs for various issues. We've started our Medi-Cal renewals, or, you know, they will be effective in June, essentially. So those are now issues, yes. And so we want to make sure that people know how to go back and forth between programs and to get seamless coverage and, you know, keep access to their providers.
Great. And just to pivot on the language access issues, I mean, I know we've talked with you guys about, you know, some of our community partners are very willing to review or look at some of the materials, some of the educational materials. I think it's difficult sometimes when, you know, these materials, I realize you're coming at it from a marketing perspective through Covered California, maybe less so with Medi-Cal, but, you know, there's kind of a rush to create lots of materials to get out there, and yet sometimes the materials just don't, you know, quite resonate or translate. And we saw that, I think, with a little bit with the marketing campaign as well. And so, you know, just want to offer that, put that out there, that I think, you know, community groups want to play a role in looking at reviewing some of the materials that you create for, you know, health literacy and just for content, language, syntax, all of that. So just to put that out there. And then, you know, finally would love to hear kind of your thoughts, Sara, on the next steps for the CEC program. You touched on it a little bit, I think, by, you know, talking about combining the outreach and education with the enrollment, but kind of what is your thinking moving forward, and the, you know, rollout and timeline and all that. Thanks.
So I don't want to preempt the board meeting that's coming up. So if you're interested on that topic, I would suggest you come to the board meeting. It is on the agenda in the context of our budget discussions.
Okay, sounds like people will have to stay tuned for that one.
Stay tuned.
Other questions?
Beth Abbott from Health Access. I think that one of the big things that was a disappointment for you and for us was that the provider directory had to be taken down because of its workability and its accuracy and that kind of stuff. And it's really a key element for consumers to determine which plan they sign up for. One of the things that I think was a workaround or a backstop proposal was to have consumers call their provider and say, are you enrolled? Or call a provider they're interested in enrolling with and say, are you on X plans list? But I think because networks are different, I think even providers, physicians are not necessarily reliable sources. They say, are you on, let's say, for example, Blue Shield's plan? And they say, oh, sure, I take Blue. But it may not be Blue Shield's Covered California plan. So I think that the provider directory is really important. So could you give us a sort of a timeline on how that is, how that's working to get fixed, or what other mechanisms you're using, or do you see that as a problem, or whatever?
We definitely see it as a problem and a challenge. You know, it's one of those things where we overpromised and underdelivered. I mean, that's just what happened. So, so we are working very, very diligently with our health plan partners. You know, one of the stop gaps too that we put into place was creating the links from the Covered California site over to the plan site, so that at least they would be able to see on the plan site, you know, what are the providers that are available. And I can tell you that that's certainly a top priority for us, to see what can we do to make sure that as a consumer, when you're picking a plan, you want to know, well, what doctors are available. And we certainly recognize that, and it is a top priority that we're working with our health plans on. I can't provide you a timeline for that, but know that it is something that is at the top of our list of things to do.
Great.
Mr. Perry, are you doing a follow-up study to this? And if so, on what? Or is it indecorous to ask?
They would have to fund me, if there was going to be done. That's her. I know they are. I mean,
I did mention a couple of the consumer experience studies that we are that we will be releasing some results from in the coming months. Both the in-depth examination of the online application experience, and also people's experience actually seeking and receiving care with their new insurance. So those are just two of the studies we have coming up. And of course, we do have a whole array of ACA-related work that we're doing, where we're trying to, you know, elucidate and you know, identify policy issues coming up.
Amy,
So-
could-
and you may see more of Mike Perry in the future. You may. I won't rule that out.
Could I make a quick comment on that?
Yes, please.
So I think it's interesting that in the no wrong door era, the one door that was wrong for this study was the person who walked into the welfare department. And it's interesting because one of the findings was more people wanted an in-person experience than we thought. And I think that's true from how we roll this out. We very much de-emphasized the ability of someone to walk into a county human services agency to apply not just for Medi-Cal, but for APTC. I think we realized in the course of implementation that more people wanted that than others expected. We kind of knew it. But as we think about studies in the future, I think it would be helpful to look at, if we're going to look at the experiences across all the different doors, it seems odd that that door continues to be one not on the docket.
Yeah, no, point well taken, and I think that may be a topic of interest for a future examination. I don't know if Mike wants to add anything.
no, I think you're right. I think that definitely an important topic.
Great. I want to take any other questions over here. Right there in the suit.
Hi, Michael Lujan with Limelight Health, and also the chair of the Diversity Task Force for the California Association of Health Underwriters, and formerly covered California. Hi, Sara. First, I want to be remiss if I didn't thank you for putting on this event and all the wonderful work and research that you produce, and encourage you to keep hiring Mike. This is excellent.
Thank you.
Mike, you planted him, didn't
Wow,
you?
yeah.
We've never met, I swear. But I wanted to ask, following up on the question of in-person enrollment events, and as one who has my own observations, having attended about a dozen or so, what are the observations maybe of Ms. Vasquez or Frank? What are your observations of having CECs and agents together in a unified effort? In my experience, they worked quite well, and I'm curious if you had the same.
Really interesting question.
Yeah, I don't see that there's a problem with that. I think that, we're all working to support each other and support consumers. I think especially given, as you know, we didn't have enough CECs on the ground to really meet the demand. And so you need to have, and not just agents, but also eligibility workers that can go to these events and work together to do it. So I would encourage more events where we are collaborating when possible.
I second that. I think that there were events where eligibility workers were present that worked better, and events where they weren't. Medi-Cal's complicated, and the gentleman talked about the mixed family that has APTC and Magi Medi-Cal people. There's a non-Magi Medi-Cal program with millions of people in it as well. And there are people with family members among all of them, not to mention their receipt of CalFresh or CalWorks. And I think, we want CECs to be as knowledgeable as possible, but it's better in events like that if there are eligibility workers who are trained to do this kind of stuff sitting next to them.
Hi, excuse me. Hi, my name is Julia Marin. I'm a LA County eligibility worker. And I agree with Mr. Mecca about the report. The poor accuracy is something that we have been experiencing in our district, which is our county building. But I have a question for Mr. Mecca. Can you explain why the interface is so important? Interface is so important to customer service between Cal here and the South.
Sure.
And also, did client express if they have applied more than one time due to receiving the notice, not receiving any notice?
Yes, so I guess I should have explained a little more. So this interface that you hear all about, it's the system of record for people in Medi-Cal is SAWS, Statewide Automated Welfare System. It can't make any decision for Magi Medi-Cal without its partnership with CalHears. That partnership is a highway, an electronic highway, and it's the interface. If the highway's clogged, the information doesn't go back and forth, and then clients have the experience that was referenced in the report. So there's been a lot of effort at DHCS and at Covered California to get that interface right. It's complicated stuff, and everybody's working really hard on it, but there's work still to do. Your second question was about people who end up applying twice because they end up being confused. It's one of those things that hopefully doesn't happen the second time around, but it's not an easy thing to fix. So we have to work through getting things like that fixed, and then hope that the second time around the experience doesn't occur.
Great, thank you. Other unanswered questions? Right here? Can somebody pass her a mic, please? Thanks.
Hi, can you guys hear me okay? Yeah, okay. My name is Nicole Stefko. I'm with the California Primary Care Association. And again, obviously to start with things, very, very much thank you guys for doing all of this and pulling this together, the data. We're hungry for this. We want more of it. So keep it coming. We love this. Also, too, just kind of recognizing a comment that somebody had brought up, I think from CPEN a little while ago. We are very much here as both a partner and a resource, and definitely want to open up and continue the path that we've already started. I know that we've had a presence at the 1296 stakeholder meetings, and we love to be able to offer up comments and feedback on anything that you're willing to share with us before publishing, because I feel like there is very much a vested interest in being able to get that languaging correct, as you were speaking to earlier, Sonia, about really being able to nail down the language, even for those of us who are English speakers. And I think that we have very much some resources to be able to offer that to you. And then also running, might be getting ahead of myself here, feel free to stop me, but I actually got an email while I was sitting here from some folks who are still struggling to get through the CEC pipeline, knowing now that we are hearing from the consumers that they're hungry for this in-person experience. kind of putting on our hats of looking forward. What is this going to look like for recruiting and getting more CECs on the ground? Just kind of running with that.
So your specific question would be?
Yeah, what are we going to be doing moving forward to help get people through the CEC pipeline, and then also what kind of training needs are we getting a gauge on from folks on, like, how many more CECs do we need out there?
How many more do we need?
Yeah.
Is that something you feel like you can comment on, Sarah?
So it's not just CECs, right? So as we talked about, this is a collaborative effort. So it's really about what is the service channel? What does the workforce need to look like? So it's not just CECs, it's the navigator counselors are going to be coming on board, it's the county workers, and it's also the agents. And so those are the discussions that we will be having in the near future about really what worked. So from our perspective, we have that narrow focus on our QHP eligible population, and I know that sometimes we need to broaden that, but we need to take a look at it from the Covered California side on which service channels are really meeting the needs of which populations. And so those are some of the discussions that we will be having. And we really feel that it is an integrated approach. It's not just going to be the counselors. It'll be a mix. And then when you look at the counselors, do we have enough bilingual counselors? We did a huge effort to try to get more bilingual counselors, and I think we're now up to like 60% of our counselors are bilingual in Spanish. So looking at that and really taking a look at the end of open enrollment. We haven't really looked at the data and who we enrolled. Obviously, Latinos are going to be a big focus of our efforts during next open enrollment. So do we have enough bilingual staff to support that population along with all of our Asian language populations as well? So that's kind of my answer to that. And then also on the pipeline, we will continue to have trainings. We sort of went on hiatus for a little bit on the training piece of it just because we needed to take a breather and relook to see what the structure was going to look like, but we anticipate having the training up and running again. There's specific issues on trying to get certain people through the fingerprinting process. Be happy to talk to you about that separately.
Great, thank you. I think right here in the red.
Hi, Lisa Chan-Son with Harvard Consulting. Thank you very much for putting this on. I think this is really interesting feedback from the field. My firm's been doing a lot of work with various SEIU locals as well as lots of different organizations that are doing a lot of education and outreach on the ground. And I have two questions. My first question is for Mike. The results are really fascinating, and I was wondering what percentage of the people that were surveyed access and did enrollment online, and if there's further research that will be coming out on the experiences for people that have been getting in-person assistance. I'm curious to see how the consumer experience changes depending on which door they're coming in through. And then my second question has to do with education. Certainly there's lots of different types of education. There's education on Covered California and Medi-Cal and how to access coverage. And then there's the education component after enrollment, which is, how do you find a doctor? How do you access coverage and care? And I think one of the things that we can learn from the Oregon experience is that the importance of explaining to newly enrolled individuals where to access care so that you don't have this situation where a lot of folks are going to the emergency rooms now that they have insurance and coverage, because that's where they're used to getting coverage and getting the care. There's probably room to talk about who does what type of education, and I would be very curious to hear folks' views on who is responsible for which part of the education process to really help consumers, because people have very limited time and education spans. There's only so much education that you can do sitting in front of a person one-on-one in any given setting. And so there probably needs to be some ongoing dialogue with individuals that are newly covered.
Great. So I think you asked me what was the breakout of people who applied online versus other ways. So we had 44 people who applied online. We had 14 in person. We had 14 by telephone and 7 by paper. I think this topic, I think there should be a survey. I mean, this is just qualitative research. I'm sure Sarah maybe has one planned, or maybe the California Healthcare Foundation, but it would be great to look at a larger population and look at these different avenues of how people enroll and how that experience was different. In terms of, I think you asked, is there any future study looking at the in-person experience, enrollment experience? Did you ask about that? Did I hear that right? I don't know if you guys.
I believe you heard that right, yes.
Okay. Do you have one planned?
That's certainly a topic that we could consider in the future. The foundation doesn't have one underway right now or in the works right now. We would certainly also encourage our partner foundations and others to, take a look at that as well.
I will add, because we heard from a lot of CECs in the study, we did hear a lot about the in-person enrollment experience. From the consumer point of view, I can tell you they were pretty happy with that in-person. They tend to be very satisfied consumers. They really appreciated that in-person help. So it was a pretty positive feedback from both the CECs and the consumers.
I want to flag one quick thing just to add to about the pathways. Is just that my memory, and you'll correct me if I'm wrong, is that many people used multiple pathways, right? So those are not mutually exclusive groups, right? We had people using 3 or 4 different ways that they were seeking to enroll. So I think that's important to remember. So you had a second question about what type of education and sort of who is responsible for what. I think maybe that was in response to comments from DHCS and from Covered California about the role of the health plans and the different partners. Would one of you like to comment on that? That'd be
Sure,
great.
Sure. Right. One thing that we found in looking at the analytics for the Covered California website is what parts of the website people go to most. And the FAQ section is one it gets a lot of traffic. And so we've tried to build that section up more and more and then refresh it, et cetera. We also have a more and more extensive FAQ area on the DHCS website. That's just one piece. It's really got to be a multi-pronged approach, but I just wanted to note that in case you didn't know how heavily trafficked that website section was. And the other piece on the data, just to let you all know, as part of our AB 1296 work group, we're working on a report that's required by AB X11 at the end of April, which is coming soon, and a legislative report on the modalities to not necessarily ascribe any particular experience to any modality, but just getting the data, getting the raw data out of all of the various systems and the survey, and publishing that so we can start with that. And it's, again, it's an ongoing dialogue, and I would encourage all of you to join and participate in the 1296 work group. And then also we're doing consumer focus group partnership with Covered California to look at what to put on the front of the website and what to put in subsequent parts of the website, because we want it to be consumer driven. We gave some homework to our 1296 work group as to how to frame the front landing page and other parts of it. And there's no sort of obvious solution to frame all the multiple messages that we want consumers to know. And
actually, could I just comment on that?
I'm
really
sorry,
quick?
absolutely, Sonia.
So community health councils and many of our partners, we're big proponents of a comprehensive set of services, that it's not just outreach and enrollment, but it really is providing utilization, redetermination, renewal follow-up. In LA County, we First 5 LA funds a program through the Department of Public Health called our Children's Health Outreach Initiative, and it's just that, right? It is organizations that not only do we do enrollment, but we follow up with our people enrolled. We do follow-up calls at 6 months. Are they using their services? Do they have questions? And at 11 months, do you need us to help you with your renewal paperwork? And at any time, if you're having problems, we're there to help you. It is an expensive proposition, I would say, even when done really well and efficiently, but it is something that many people need, and I would venture to say that, especially in this world where you have a lot of people that are new to coverage, you need that somebody that you can connect with on an ongoing basis to answer questions for you, in addition to your health plan, your provider, and the program.
Very good, thank you.
Hi, my name is Kenna Burke, and I'm with the California Medical Association Foundation. And we were actually granted to provide provider education. So we've been out kind of on the other side of it with the physicians. But I do have 2 questions because things come up within our discussions that we really feel you need, besides the directory issues and things along those lines. One of the things that's really important, and I'm actually looking at bridging, until the next point, but we are hearing a lot of questions in regards to out-of-network providers and who they are and how to communicate that out to consumers so they understand that process as well. The other question that I have for you is that when we're out talking about Medi-Cal, because we do talk about the expansion of it and the increase in the numbers in the population, one of the questions that have been recently that we're getting is in regards to people that have applied and not received any information, and that the backlog is actually going to be a few months before it gets cleared up. And so my question to you in regards to that is what communication is going out to consumers and what can we provide also to providers?
So as far as the communication, again, we try to put as much as we can on our website. There is an initial document that goes to folks to let them know we've got your application online. And part of it too, though, is that, it's not that everyone has applied solely through the website. So some people may have already spoken to their county worker, or they've talked to them on the phone or in person. So it's not to say that everyone uniformly has no idea what's going on. There's different experiences, different venues, different things happening all at the same time. We did a large batch of presumptive eligibility, basically giving 180,000 people a benefits card back in December. But a lot of the people who've newly applied, just in the last couple of weeks, there was a big surge of people who applied at the end of March. Those folks, they're in the pipeline. Counties are working hard to process through those cases. It's going to be a few more weeks. It is going to be, but just to say, a lot of the backlog has gotten cleared.
So, and lots remains.
Right, and lots remains. Both are true.
I just want to be clear that there are people that have applied in December who don't have an answer. There's not a lot of them. Well, a lot is a relative term. There might be a lot of them depending on your point of view, but Anastasia's right. The backlog is not a monolithic thing. Right. People are all different places, but I think it does need to be said that when you have a backlog of that many folks, people continuing to apply, and then we're going to start renewals in Medi-Cal, which is kind of the big workload for Medi-Cal other than intake, the redeterminations. And we're going to start renewals by doing 2 months within a month. So for January through May or so-ish, we did not do renewals. So for people whose renewals would have occurred in that period, we're going to pick them up later. So for 5 or 6 months, we'll be doing double renewals. We'll be trying to work through a backlog with hundreds of thousands of people and process new intakes. So I don't want to leave anyone with any impression that we're like on the cusp this weekend of getting it all worked through. We're good. And hopefully notices of action will be ready soon so that we can start a process of communicating with people that's better than kind of having the onus on them to seek out a website to figure it out. But we have a couple of months, probably optimistically, to try to work through this. And this assumes that the technology is sort of stable and continues to support the workload to work through it.
So I'm getting the signal that our time, do we have time for one last question? Okay, I think you've had your hand up for some time. This is going to be our last question.
Thank you. My name's Ethan Evans. I'm a PhD candidate at UC Davis, and I heard someone mention something about raw data, and so I'm interested in that. I wonder if anybody could speak to where the best places at this time. I know folks are really busy, and sort of timelines about raw data. Covered California's put out sort of regional snapshots on a pretty periodic basis, but I wonder if there was another schedule and where we get
PhD students love data. Can you point him somewhere?
So again, through our 1296 process, we have a report that we'll be releasing, the end of this month, early next. It's right now there's not a table of raw data that's available. Frankly, part of the challenge is that it's a live system. People are going in and out every day. So, we don't have a sort of research-based sort of data table available. And frankly, our main focus is getting people enrolled, getting their coverage effectuated, making sure that EHIT, the interface performance, is stable and working correctly, getting whatever other fixes we need into the system. So I know that there's a great hunger for data and analysis, and we're working on that front, but our highest priority is getting coverage effectuated.
Great. Thank you so much. I want to thank Mike and Sean for all their hard and speedy work, and I really want to thank our terrific panel up here. And I want to thank all of you for coming today. Thanks so much. And don't forget this handy evaluation form in the back, please. Thank you.